NGN NCLEX NCSBN Practice Questions Updated Full Test 2026. Question 1. A client diagnosed with schizophrenia first speaks animatedly to another client, with exaggerated clarity of pronunciation. The nurse then observes the client turning abruptly away, mumbling to themselves and speaking to the wall. Which priority goal/outcome should the nurse select for the client's plan of care? Option A. Client will express feelings appropriately through verbal interactions. Option B. Client will accurately interpret events and others' behaviors. Option C. Client will engage in meaningful and understandable verbal communication. Option D. Client will demonstrate improved social relationships. The correct answer is option C. Client will engage in meaningful and understandable verbal communication. 3. Question 2. The nurse is working in an inpatient psychiatric setting and understands that touching clients should be limited to a quick handshake. For which reason? Option A. Touching a client, other than a handshake, can set off a violent episode. Option B. Refraining from touching signals the termination of the nurse-client relationship. Option C. A handshake allows the use of therapeutic touch while maintaining boundaries. Option D. A handshake will not be misinterpreted as an invitation to more sexual behavior. The correct answer is option C. A handshake allows the use of therapeutic touch while maintaining boundaries. 3. Question 3. The nurse in a behavioral health inpatient unit is observing a female client who has been diagnosed with obsessive-compulsive disorder, OCD. Which behavior should the nurse expect to see with this diagnosis? Option A. The client is seen washing her hands every 15 minutes. Option B. The client exhibits repetitive, involuntary movements. Option C. The client verbalizes suspicions about thefts on the unit. Option D. The client prefers to interact with female staff members. The correct answer is option A. The client is seen washing her hands every 15 minutes. 1. OCD is characterized by repetitive, unwanted, intrusive thoughts, obsessions, and irrational, excessive urges to perform certain actions, compulsions. Question 4. The nurse is caring for a client who has an alcohol use disorder, AUD. The client states that the client's dysfunctional family caused the addiction. Which response by the nurse would best help the client accept responsibility for their own behavior? Option A. It was your choice to drink, so you need to take responsibility. Option B. It is wrong for you to blame your problems on your family. Option C. Yes, I can understand that families can be tough to deal with. Option D. The lab report showed a high blood alcohol level when you were admitted. The correct answer is option D. The lab report showed a high blood alcohol level when you were admitted. 4. Question 5. A nurse is collecting data on a client believed to be in an abusive relationship. Which client statement is most indicative that this individual is experiencing intimate partner abuse? Option A. I must have done something to deserve this. Option B. No one else in my family has been treated like this. Option C. I have only been in this relationship for 2 months. Option D. I will keep praying that things will get better. The correct answer is option A. I must have done something to deserve this. 1. Question 6. A home health nurse is caring for a client diagnosed with late-stage, Lewy body dementia, LBD. The nurse is meeting with the client's family to discuss options for care of the client. What is the initial question the nurse should ask to assist the family with their decision-making process? Option A. What is your opinion of nursing homes or assisted living facilities? Option B. Is your parent currently taking over-the-counter, OTC, or prescription medications? Option C. Are you able to assist with the care of your parent in any manner? Option D. What type of assistance does your parent require? The correct answer is option D. What type of assistance does your parent require? 4. Question 7. The nurse is caring for a client with paraplegia due to a spinal cord injury at the T7 level. Which nursing intervention should be a priority for this client? Option A. Obtain a pressure-reducing mattress for the client's bed. Option B. Observe the client performing self-catheterization correctly. Option C. Consult with the discharge planner about equipment the client needs at home. Option D. Encourage the client to increase intake of fluids and high-fiber foods. The correct answer is option A. Obtain a pressure-reducing mattress for the client's bed. 1. Question 8. The nurse is evaluating the plan of care for a client with osteoporosis. What type of activity should the nurse reinforce for this client? Option A. Enroll in a kickboxing class twice a week. Option B. Walk for 30 minutes. Option C, to 5 times a week. Point 3, participate in swimming lessons 3 times a week. Option D, go jogging 5 to 7 times a week. The correct answer is option B, walk for 30 minutes. To teach the client, or reinforce teaching, that walking for 30 minutes, 3 to 5 times a week, is the single most effective exercise for osteoporosis prevention. Question 9. The nurse is caring for child diagnosed with celiac disease. Which of the following foods would be an appropriate snack choice for this child? Option A, a cup of cereal. Option B, a slice of wheat bread. Option C, a cup of yogurt. Option D, an oatmeal cookie. The correct answer is option C, a cup of yogurt. 3. Question 10. A client is on NPO status and has a nasogastric tube in place, connected to low intermittent suction, to help resolve a small bowel obstruction. Which nursing intervention should the nurse implement for this client? Option A, allow the client to melt ice chips in their mouth. Option B, provide oral care at least every 2 to 4 hours. Option C, swab the client's mouth, using glycerin swabs. Option D, provide the client mints to freshen their breath. The correct answer is option B, provide oral care at least every 2 to 4 hours. 2. Question 11. The nurse is caring for an adult client who suffered second-degree burns over 25% of their body in a house fire. Which observation best indicates that fluid resuscitation has been effective? Option A, elastic, non-tenting skin turgor. Option B, moist oral mucous membranes. Option C, urine output of 35 ml per hour. Option D, no reports of thirst. The correct answer is option C, urine output of 35 ml per hour. 3. The goal is to maintain an hourly urine output of 0.5 ml/hour, about 30 ml/hour, for the average adult. Question 12. Which of the following actions by the nurse indicates a need for additional education on the prevention of health-care-associated infections, HICE? Option A. The nurse uses their own stethoscope to assess the lung sounds of a client placed on contact. Precautions for methicillin-resistant Staphylococcus aureus, MRSA, infection. Option B. The nurse calls the healthcare provider, HCP, to request the removal of the indwelling urinary catheter for a 2 days postoperative client. Option C. The nurse cleanses hands with soap and water for 60 seconds after caring for a client with Clostridium difficile, C. difficile, infection. Option D. The nurse wears a gown and gloves when providing perineal care to a client with vancomycin-resistant enterococci, VRE, infection. The correct answer is option A. The nurse uses their own stethoscope to assess the lung sounds of a client placed on contact. Precautions for methicillin-resistant Staphylococcus aureus, MRSA, infection. 1. Question 13. A client has been diagnosed with dysphagia due to a stroke. What nursing intervention should the nurse implement for this client? Option A. Instruct the client to tilt their head back while swallowing. Option B. Position the client in an upright position while they are eating. Option C. Assist the client to drink through a straw. Option D. Instruct the client to use sips of water to help wash down food. The correct answer is option B. Position the client in an upright position while they are eating. 2. Question 14. A client is transferred from the post-anesthesia care unit, PACU, to the medical surgical unit after an appendectomy. Which action should the nurse on the medical surgical unit perform first? Option A. Ask the client about pain. Option B. Orient the client to the unit. Option C. Review the postoperative orders. Option D. Take the client's vital signs. The correct answer is option D. Take the client's vital signs. 4. Question 15. An obese client tells the nurse, I just started a diet and I am eating no more than 800 calories a day. What information should the nurse reinforce with the client? Option A. Very low-calorie diets often have severe and irreversible side effects. Option B. Very low-calorie diets are adequate if balanced with fruits and vegetables. Option C. Very low-calorie diets are intended for short-term use only. Option D. Very low-calorie diets are appropriate for long-term weight management. The correct answer is option C. Very low-calorie diets are intended for short-term use only. 3. Question 16. A 2-year-old child is brought to the pediatrician's office by the parents, who report that the child has been having diarrhea for 2 days. What nutritional information should the nurse provide to the parents? Option A. Keep the child fasting, give them nothing to eat, and return the next day. Option B. Give the child only clear liquids and gelatin for 24 hours. Option C, continue a regular diet and add electrolyte replacement drinks. Option D, give the child bananas, apples, rice and toast as tolerated. The correct answer is option C, continue a regular diet and add electrolyte replacement drinks. 3. Question 17. The nurse is providing care to an older adult client diagnosed with bilateral pneumonia. Which intervention should the nurse implement to best promote the client's comfort? Option A, encourage visits from family and friends. Option B, keep conversations short. Option C, increase the client's oral fluid intake. Option D, monitor vital signs frequently. The correct answer is option B, keep conversations short. 2.